This is Dr. Shelby. We're going to talk about the small pupils during cataract surgery, especially after LenSx laser. As we know, LenSx does cause a little bit of meiosis of the pupil to begin with, and when you're dealing with a Flomax patient, it can be extra miserable. And in a lot of these cases, even using sugar cane or lidocaine with epinephrine doesn't really help all that much. And here we go. There's a little prolapse of that iris. Oh, I'll tell you. I know you're probably watching this cringing at the moment. Yeah. So when you're repositing iris, make sure to put a little gentle pressure on the posterior aspect of the wound, making sure not to put too much pressure or burp any more of the iris out. And once you get it back in, try not to come in and out of the eye so much. And here you can see we're doing a little pre-chop. This is actually a toric patient. And the key to removing a cataract through a small pupil is to make sure that you confine your phaco tip to the center of the eye. You don't want to go fishing around for pieces because that's when your iris is going to want to come to the phaco tip, especially in a situation where you've had a little iris prolapse out of the wound. So you're behind the 8 ball to begin with, that iris is floppy as hell, and it's just going to get worse. And so what I like to do is keep that nucleus central and then take it a little bit at a time. And of course, with these thicker lenses, after LenSx, you got a bunch of gases built up back there, so it's putting a little pressure posteriorly, which makes that iris want to come forward even more. And this looks like it's nerve-wracking, and it is. I can tell you from my experience doing this one, it wasn't a whole lot of fun. But anyway, just like any other cataract surgery, you just get it a piece at a time and use your second instrument when you need to hold the iris margin back. And so I just pull those pieces towards me instead of fishing for them with the phaco. And keep it central. If you'll notice, the phaco tip generally stays within the center of the pupil itself. That's to help minimize the iris wanting to jump towards the phaco tip. You hold that iris margin back a little bit and deliver that piece up through the pupil like a baby. And once again, in the center, don't start giving it a whole lot of gas until you are in the center of the pupil with that piece of nucleus. Some of you are wondering why I didn't use iris hooks. Well, yeah, it seemed like a good idea once I was in the middle of all this. And so you'll see in the next case, it's actually this patient's other eye. Going into it, we knew that his pupil was going to come down and was going to act like this, so we did use iris hooks after the LenSx itself. So once you have all that nucleus, go ahead with your INA, and this is always a lot of fun too because you can't see the margin of the capsule rhexis. And the key with INAing these small pupils is to keep your INA deep and peripheral. So you can assume that the margin of your capsule rhexis is right opposed to the margin of the pupil. So keep it low. I'll swing around and try to grab a big mouthful, and then you pull centrally and go down at the same time. Obviously, this is sped up because you all don't want to enjoy the entire INA process in normal speed. And so, and remember, with any type of surgery, there's good and there's good enough. So once the center is clear, and I'm pretty sure that most of that cortex is out, go ahead and fill your bag like you normally would. This was supposed to be an aura, but the aura will not get through those small pupils. And so luckily we have the Varion overlay to help line up the toric lens. And here it is going through that tiny pupil. I know, it's cringeworthy. But luckily, if you look at his iris, it looks pretty good. It's not moth-eaten. It's still round, albeit tiny. And then I'm making sure here that the haptics themselves are actually in the bag. And then I'll pull it around to try to find the hash marks on the lens. And here's another little trick is in a small pupil like that, you're going to have some retained cortex. There's no way around it. The good news here is because he's a toric lens, some of that residual cortex will help to sear that lens into place as it heals down. but I like to rotate the lens. That'll free up any cortex that may be loose around the periphery. And try not to grab the iris like I did there. And then I like to pull the iris and check exactly where the hash marks are so I know where I'm moving it. And here we have the overlay. So I know where my preoperative axis is, and then I can move my lens accordingly. And so you can use the INA to do this completely. You just put the tip of your INA in the crotch of the haptic and just gently rotate. It'll come around. It can be a little bit frustrating with the small pupils. And there we go. Clean up the rest of that. Take one more look at the hash marks. They are within 10 degrees of our axis, and we are done. Then, of course, we check the wounds like normal. Look at that pupil. It's huge. Okay, here's the second eye. So going into it, same thing happened. We got a little bit of the post-LenSx meiosis. We're going to make our primary wound. Now this time we're going to make 3 paracentesis incisions that are aimed effectively at the center of the nucleus to go ahead and put iris hooks in. Now I do mine as a diamond pattern. There's a triangle. I do 3. I rarely do 4. And the goal here is to try not to hook the edge of the capsule. Now, if you do hook the edge of the capsule rhexis, which I did here on this nasal one, you can kind of see it tugging right there. Sometimes that's avoidable. You know, this lens was thick. The pneumo dissection of the lens caused it to come up even further. And here, there we go. So that margin pops out. All right. So it ain't pretty, but it's a hell of a lot better access than that first one. And so we do hydrodissection just like we normally would, rotate the lens a little bit. I'm a fan of the pre-chopper when I can, especially after LenSx. So I just separate a little bit. And this was a fairly dense nucleus, which added to the fun of this case. And so, once again, I like to open the trough just a little bit to be able to get my second instrument in there to get a good seat in the nucleus, not in the epinucleus. If you make it too thin, you're just going to be digging through epinucleus. Then crack is normal. But look at this one compared to the first one. The nucleus comes up very easy. I can move the phaco tip around with much more freedom. I'm still careful of avoiding the iris margin because I really don't want to eat up any of that pupil and have a really nasty looking iris afterwards. And there comes that nucleus. And look at that. There we go. And then INA is normal. And you can kind of see where that nasal hook has grabbed the bag. Ironically, in this case, the nasal hook, even though it grabbed the rhexis, there is and you'll see it here in just a minute, a small capsular tear anteriorly and at the inferior iris hook. And there is that subincisional, which is everybody's nemesis. And I know people are going to say, oh my God, you didn't polish the bag. Like I said, I consider this a win, just getting the cataract out and the vast majority of the cortex. And here we go. Now with this one, I was able to catch an aura because obviously the pupil was big enough, albeit it looks like a triangle. And here comes the lens. Obviously much less stressful insertion of the lens through a somewhat normal sized pupil. You can see the hash marks much better. We line it up with our aura. Making sure it's in the bag. I was very careful there not to over pressurize because of that rent in the inferior capsule. Then you just take your iris hooks out like normal. I do not use a Malyugin ring because in my opinion it's too big and it scares me. It doesn't really scare me. And putting it in is not difficult, but taking it out is a booger. There we go. You can see that rent inferiorly, and then there's a piece of nucleus that was caught at the margin. And I just feed that in with the second instrument. And once again, try not to move that tip around too much. Hydrate your wounds as normal. You can see that little flap tear. That's going to heal nicely. And that's how we do those small pupils with and without iris hooks.